All right, let's go ahead and get started. Hello, and thanks for joining us for today's presentation. Thanks for joining us on your lunch hour, if it is your lunch hour. I'm Megan Francis. I'm the marketing coordinator for Updox. Before we get started, I just have a few housekeeping notes. You'll notice that the phone lines have been muted as we're recording today's presentation. We will be leaving time at the end of the webinar for any questions you might have. So if you feel one pop in your head, you can enter that in the GoToWebinar panel, and we'll review as many as we can at the end of the presentation. If we don't get to any of your questions, don't worry, we will be following up with a Q&A session, and our business development reps will also be giving out calls just to follow up and make sure you got the recording as well. Now, to get us kicked off, today's presenter is Chris Tremblay, Updox Director of Product Marketing. Chris has nearly 20 years of experience in healthcare IT and has focused exclusively on building and marketing tools that allow independent practices to run their businesses effectively and care for patients effectively. She spent part of her career at Navinet, where she built tools for providers to manage claims and payments with health plans. Most recently, she was the director of product strategy for Amazing Charts EHR, where she expanded their solution suite to include EHR, practice management, and patient engagement software and services. Chris, whenever you are ready, take it away.
Thanks, Megan. Great intro, and welcome everyone. Today we're going to give you some information about how to use your Updox tools to succeed under the Mips program. We know we have a mix of both existing customers on the line with us today, along with people that are considering using Updox. So there's a little bit of overview information about Updox that we'll share, and then we'll jump right into our overview of Macra and Mips and give you some real examples of how to meet the regulations using the tools. So let's get started. Who's Updox? Updox is a communication platform that was built by physicians and for physicians. We currently have over 56,000 providers using the software, 300,000 users across all of those practices, and over 100 or more now EMR integrations. 8.5 million patient portal accounts, a real testament to the tools and how they've been implemented in your practices, and over 1 million direct email addresses in the global directory that connect you to other providers. Updox is your single source for patient and provider communication, and we want you to optimize the way you use it. So Updox offers tools that focus on optimizing your practice, making it more efficient. Those would be our document management solutions and digital faxing solutions. If you haven't gone paperless yet, you really should consider that. Practices save money every month by managing paperless fax and improve their workflows by implementing a single integrated digital document workflow. Our other tools also include messaging and reminders to help get the word out to your patients when they need to come in and when they're due for services. Clinical communication simplified. We know that you probably look like the octopus in the picture, trying to juggle a million tasks a day, and you really need something that can help organize, accelerate, reduce the manual work that comes up every day. So let's jump into Macra. Macra stands for the Medicare Access and CHIP Reauthorization Act of 2015. It was a law that went into effect and changed the way that healthcare services in the future will be paid. Macra includes a quality payment program which outlines that physicians will be paid in under one of two systems. First is MIPS, the merit-based incentive payment system, and the second flavor is APM, or alternate payment models. Today we're going to focus exclusively on providers that are participating in MIPS. Under an APM, you would likely have a different set of reporting responsibilities depending on what program you're participating in. So what is MIPS? Well, it's the new payment system combines the old programs, PQRS, meaningful use, and the value-based payment modifier into a single system. The system measures quality, cost, improvement activities, and advancing care information. And a composite score is developed that then determines what your future reimbursements will be. The composite score looks like this. For the 2017 reporting year, which is ending at the end of this year, you are only required to report on quality, which is actually 60% of the score. Your quality measurements are likely coming from your electronic health record solution or from a registry that you may be enrolled with. Improvement activities, which you are going to attest to having done for a period of 90 days during the year, and we'll get more deep into improvement activities today. And advancing care information, which represents 25% of the score, and is largely focused on the implementation of health IT in your practice and how you actually use those tools in your everyday communications with providers and patients. So you have some options on how much you want to do in 2017. I believe the CMS called it Pick Your Path. You are able to do the very bare minimum, as you can see in the test column. Let's assume that you're all on the line intending to participate. But if you don't, that first column would apply to you. And in 2019, 4% would be deducted from your Medicare payments. So let's assume you're all participating. Under the test scenario, you would essentially report on one activity, either one quality measure, one improvement activity, or the required advancing care information measures. You won't see a negative adjustment. You won't see a positive adjustment. It's essentially a reporting exercise that would avoid achieving a penalty or an incentive. Partial participation is listed here as 2 quality measures or 2 improvement activities or the 4 required ACI-based measures for at least 90 days, and you could increase your Medicare payment. The composite scores are all going to rank on a bell curve, so you won't really know until the end of the cycle whether or not those activities have earned you an incentive. Certainly the full participation path would be the way to go to increase your Medicare payments in the coming year. So this is what incentives and penalties look like in years coming. When you report your 2017 statistics, they will affect the payment you receive in 2019, either negatively by 4% or positively by up to 4%. And then those percentages increase year over year, as you can see here. Now, let's be clear. You all read the news. You've seen the recent publications from CMS and the new administration that indicate that in years going forward, the MIPS program is likely to change. And that may, in fact, be true. It does appear that they're going to take a close look at quality in particular and how you are reporting those measurements. But for this year, there will be no change. The reporting requirements remain what they are, and you should be expecting to report within the first quarter of 2018. So advancing care information was the category we talked about that mandates that you have implemented a certified electronic health record and that you're using the features that are included there to share information with others. One required measure that Updox clearly helps you meet is to provide patient access. This essentially means that at least one patient that you've seen during the period you're reporting for has been afforded access to view their record online, be able to download it, and send it to a third party. So if you've implemented the Updox portal, those records are moved automatically to the portal so that patients have the ability, every patient you see during the period should have that feature, and you would be able to report both a numerator and a denominator score for this, which could earn you an extra 20% performance score for this category. Additionally, there are measures listed here under advancing care information categories that are not required but are suggested and can also earn you performance points. So utilizing secure messaging for your communication with other providers earns you a performance score of up to 10%. And the category for patient-specific education can earn you up to 10%. If you struggle with handing out patient education while the patient is in the office, you certainly could deliver it securely after the visit via the patient portal and earn that extra score. So something brand new, and I apologize, I should have filled in the date this rule came out. I believe it was last week. I've added a glossary addendum to the end of this presentation. You'll all receive the presentation in a download format after a couple days after we conclude this session. But there was a recent guidance issued around prevention of information blocking. And providers that are participating in MIPS must attest to the following things. That they did not willingly or knowingly take action to limit or restrict the capabilities that are included with their EHR. Then they must attest that they have actually implemented procedures and policies and workflows within their practice to use the electronic health record solution and communication tools. And then also that if they're receiving requests from other providers or patients about retrieving or exchanging electronic health information, that they're taking all the steps necessary to satisfy those requests and not block information where it's needed and when it's needed. So this is an attestation wanted you to be aware of, and certainly your optimal use of the tools, including the Updox patient portal, would allow you to attest successfully that you have implemented the tools as required under the law. So let's move on to improvement activities. That accounts for about 15% of your score. And there are lots of improvement activities that you can review. In fact, there are 92 the last time I counted. And those activities are weighted. Some of them are defined as medium activities that qualify for 10 points of your score, and high value activities that represent 20 points of your score. There's no guidance on how you should implement these types of activities within your practice, and you will attest to having done them. For small groups or individual clinicians, the number of points that you need is lower than it would be in a larger practice. So we've put together some information here for you that can explicitly show you how Updox tools could help you specifically for this category. I'll apologize for the information density you see on this slide. I copied and pasted the descriptions of these directly from the CMS website, which is listed in the appendix. go back and actually look these up yourself and select to attest for them if you've established these practices within your business. So things like care transitions and care coordination are perfect examples of how you could use the direct messaging platform and the universal inbox to exchange information with other providers and with patients through the portal to meet these program requirements. You could put a system in place in your practice that tracking your referrals so that you are sure that you're receiving a digital clinical summary and a plan of care after the visit. And certainly that can come on your paperless fax through the mail itself or preferably on your direct messaging. You can also conduct follow-up with the patient if needed by sending them a secure message via the patient portal or sending them a reminder about an upcoming appointment. Here are some more examples of how you might be able to maximize patient engagement, which is much of the focus of this category for MIPS. So there are options around integrating patient coaching between visits. That could be tips and tricks that you might send to the patient about how to reduce salt in their diet, or patient education materials. Potentially, for the second one here, implementation of condition-specific chronic disease self-management programs. You certainly could target patients in your practice that have certain chronic conditions and suggest, support resources in the community or even from your practice or facility, and meet this pretty easily using the electronic tools that Updox provides. And then we all know that every practice is focused on keeping their patients healthy, and the ones most at risk are ones with chronic diseases. So CMS would love for you to implement a program that you would follow that includes reminding patients about preventative care services, suggests treatments, sends out potentially pre-visit questionnaires, or provides a regular touch point with the chronic care patient about how they're doing. Any and all of these things would meet the program requirements and could all be done, digitally without a whole lot of extra phone calls happening at your practice. So one of the really cool tools that Updox offers is a product called Blast Messaging. Blast Messaging allows you to configure a list of patients and get a notification out to them. So the most common use cases would be things like it's flu shot season and you'd like your patients above a certain age to come in and get flu shots. You certainly could configure a blast message inviting them to come into the office for an appointment or to book an appointment online using the Updox portal so that you can get to all those patients at once. You could think of doing something more specific with blast messaging, like targeting all the diabetics in your practice to make sure that they're aware of how important it is to be checking their A1C counts at regular intervals. Those patients could be identified in your electronic health record via a list and put through the Blast messaging product. Blast allows you to create that list. You can customize it. After you've sent out your messages, you have access to reporting that shows you here how many were delivered, how many were not delivered, so that you can triage this list and perhaps recontact people that might have missed your message. Provider communication tools, provider-to-provider communication tools are especially important in your practice as well. You certainly are managing a large list, potentially, of referral relationships. You want to be able to continue to nurture those relationships. Our blast messaging platform allows you to contact all your referral partners in one fell swoop if you'd like to do that. And potentially you could let them know about a new location that you're opening or a new service offering, expansion of service hours, etc., so that all of your referral partners are in the know. Blast messaging helps you boost revenue, of course. Appointments are often seasonal. You may have cash services that you offer in your practice as well that you'd like to get notifications out about, and certainly if a message going to hundreds of patients all at the same time with a single message is certainly more efficient and cost effective than either a postcard or a phone call. So the Updox Solution Suite really runs the gamut for the messaging platform that we just reviewed and specifically, along with all of the workflow automation we can bring to your practice. And then patient engagement, can't be understated. You want that communication to be a two-way communication between your practice and the patients. The more you can contact them digitally, the better they respond and adopt the portal itself. So really encourage you to take a look at utilizing both the portal and messaging, not only to reach your compliance goals, but to also boost engagement and patient satisfaction by communicating with them in ways that they're comfortable. So you'll see here that there's a couple of different packages available. If you're not already signed up for all of our services, definitely please contact us and we can see about upgrading you. We can start you off with a free trial, no hardware, no contract. There's never a charge for training or support, and our teams are always at the ready to help you whenever necessary. We recently added online chat. If you haven't heard about that, please hit the updox.com website, and someone on our chat support team will be able to help you with an issue immediately, as well as our sales team if you're interested in talking to sales. And our promo code for the fall is stuffing, which I hope most of us will be doing at the end of November. But that qualifies you for a full 10% off an entire year of the Updox service, which is just an incredible value. Here are the Macra and Mips references where I created this content. I will encourage you to visit the CMS website and use their interactive tools. They are very good and explain in far greater detail than I have today what all of your options are for participation. I've linked you specifically to the list of improvement activities. That's the 92 things that you have to choose from that you will attest for, some subset of those. And then the newest guidance document for information blocking that I reviewed with you is also available on that link.